Have you been wondering how to help your baby clear a runny nose, nasal congestion, and cough? In this video, I'm going to focus on the best approaches for children 12 months and younger. And I'll end by talking about the symptoms that indicate you should have your baby evaluated by a healthcare provider. Upper respiratory infections, also known as the common cold, are the most common illnesses that babies experience. There are more than 200 different viruses known to cause the symptoms of upper respiratory infections. Runny nose, nasal congestion, and cough are present with many of these viruses. The child's immune system is well equipped to take care of the viral infection itself, but since they can't blow their nose or spit out the mucus that accumulates at the back of their throat, there are things you can do to help with those symptoms. First, I want to mention the common symptoms of an upper respiratory infection in babies. With many of them, the baby will have a runny nose, nasal congestion, and cough. The following may also be present: fever, sneezing, sore throat, decreased appetite, decrease in activity level, and increased fussiness. Usually after onset, symptoms tend to become worse the first 2 to 3 days, and then they usually start to improve. Initially, the mucus starts off transparent, thin and runny. However, within the next several days, it becomes thicker and can change to a white, yellow, or green color. Contrary to popular belief, the mucus changing to one of these colors is not necessarily an indication that the baby now has a bacterial infection. As the mucus thickens, less will drip out of the nose and more will start to drip down the back of the throat. Around this time, the cough will tend to get worse and can become more wet sounding. Because of the mucus, some babies will even have a rattling sound in their upper airways. A lot of parents become concerned about the cough, but in most situations, when it's associated with an upper respiratory tract infection, the cough is actually the body's natural mechanism for protecting the lungs. When the mucus moves from the nose down the back of the throat, the baby will cough to prevent it from going into the airways and lungs, and instead moves the mucus into the digestive tract. On average, an upper respiratory infection will last around 7 to 10 days, although some babies may have residual symptoms that last longer. In the first several days of an upper respiratory tract infection, when thin and runny mucus is coming out of the nose, you can help the baby breathe better by doing nasal suctioning. The best time to do nasal suctioning is either before the baby eats or goes down to sleep. When they're sick, babies are able to eat better when their breathing is not hindered by mucus. They're also able to get more uninterrupted sleep when mucus isn't blocking the nose. Suctioning the baby's nose too soon after a breast milk or formula feeding can lead to a spit up. It's recommended to limit suctioning the baby's nose to 3 or less times a day. Doing it more frequently can actually irritate the nose. First, it will be beneficial for both you and your baby if you find an approach that will minimize them moving around a lot when you're suctioning. This is easier said than done. It's normal for babies to become upset and try to move around when their nose is suctioned. And we want to avoid an injury accidentally happening from the baby moving the head or arms while you're trying to do something that will help them out. Also, you will be able to suction the mucus out quicker and more effectively when you have the baby in a position that minimizes a lot of movement. I'm going to mention several approaches so you can figure out what works best for you and your baby. For newborn to 4-month-old babies, it works well to have them either fully swaddled or just have the arms at the baby's chest. Swaddling helps babies feel more secure, like they were in the womb. It also helps you by keeping the baby's arms away from the face. If there are 2 adults present, while having the baby laying on the back, one can gently support the baby's head in place and the other can do the nasal suctioning. If you're doing it on your own, have your baby swaddled and laying on the back. Use one of your hands to gently cup the baby's jaw to support the head from moving. Place your thumb on one side of the jaw and the index and middle fingers on the other side. Be sure not to put any pressure on the baby's neck. Then you can use your other hand to suction the nose. Another option for holding your baby securely is to lay your child facing you on your lap with the head towards your knees. Use the area between your knees to gently support the baby's head in place while using your hands to suction the nose. For infants who can be placed in a sitting position, which typically occurs around 4 months or older, you can sit the baby on your lap facing away from you. This approach works best when two adults are present. One can hold the baby while the other does the nasal suctioning. The one who will be holding the baby can gently wrap an arm around the front of the child to help minimize movement and keep the baby's arms down and away from the face. Then with the other hand, gently cup the baby's jaw by putting the thumb on one side of the jaw and the index and middle fingers on the other side. Be sure not to put any pressure on the baby's neck. Gently tilt the baby's head up and rest the back of the head against your body. Now you're ready for the other adult to do the nasal suctioning. Having either adult speak or sing to the baby will serve as a distraction. If you're using a bulb suction, first squeeze the bulb to push out the air and then put it into the baby's nostril until you get a good seal. Be careful not to push it in too far to prevent causing irritation or bleeding. Slowly release the pressure on the bulb to suck out the mucus. When using a suction like the NoseFrida, make sure you have it properly assembled. Since the NoseFrida has a bigger opening, it's intended to occlude the opening to the baby's nasal passage instead of going into the nose. Put the suction mouthpiece into your mouth first, and then once you get a good seal with the tip at the baby's nostril, gently suck the mucus out of the first side and then the other side. There are electric nasal aspirators if you prefer that option. Most parents find that one approach is more effective than another. You may need to do some trial and error to find what works best for you and your baby. I have links to several of the different nasal aspirators in the description below if you'd like to check them out. In situations when the mucus in the baby's nose is a thicker consistency, I recommend using nasal saline drops or spray to thin it out first before attempting to suction it out. Nasal saline is salt water and works well for loosening up the mucus. I mentioned several great nasal saline options for babies in the description below. While holding your baby securely, put 2 to 3 drops or 1 to 3 sprays into each nostril and wait a few minutes for it to thin and loosen up the mucus. Something I find that really works, especially if it sounds like the baby has a postnasal drip and a wet cough, is to hold the baby upright after putting the nasal saline into the nose. Cup one of your hands and tap all around the baby's upper back for several minutes. Follow it up by suctioning the mucus out of the nose. Many parents notice that sometimes the baby starts coughing more shortly after they use nasal saline drops and suction. This is normal. Since the thicker mucus in the nose and postnasal drip loosen up, more starts to drip down the back of the throat. The baby will cough to protect the mucus from going into the lungs. The mucus that you're not able to suction out will be swallowed by the baby and will go into the digestive tract. Another thing that helps is the use of a humidifier. There are warm mist and cool mist humidifiers. They're both considered to be just as effective, but due to the risk that the baby may get a burn from the warm mist humidifier, the cool mist ones are recommended for this age group. Be sure to follow the instructions included and keep it properly clean. Set it on a sturdy surface several feet away from the baby's crib to prevent it from blowing directly onto the baby's face. Having it on while your child is sleeping can really help their breathing. Another option is to make it steamy in the bathroom from running hot water in the shower. Have your child spend time playing or taking a warm bath while breathing the humidified air. This will help to thin out and loosen up the mucus. If your child sounds congested afterwards, feel free to use nasal saline drops or spray to loosen the mucus up more. Then tap on the back for several minutes to further assist with loosening it up and finish off with nasal suctioning. Cough from an upper respiratory infection can be very bothersome to the baby and parents, and it tends to become worse when the baby is laying down to sleep. As I mentioned, most of the time, the cough itself is a protective mechanism to prevent the mucus that's dripping down the back of the throat from ending up in the baby's lungs. Chemical cough medications are not recommended for babies. Studies have consistently shown that they don't work and can cause serious side effects. However, a study showed a decrease in nighttime cough in babies 2 months and older who were given either 3 or 4 milliliters of agave nectar syrup 30 minutes before bedtime compared to babies who didn't get anything. You may have heard that honey decreases cough as well, but it's not recommended to be given to children under 1 year of age due to a risk for botulism. Applying a vapor or chest rub is another home remedy that has been shown to decrease nighttime cough and congestion and improve sleep. Zarbee's has a great one that can be placed on the chest, neck, back, or bottom of the feet for babies 2 months and older. By keeping the mucus thin through the use of nasal saline and a humidifier, and by helping the baby clear it out with nasal suctioning, will help minimize the cough. Keeping the baby well hydrated during the time of illness will also help keep the mucus from becoming too thick. Now let's talk about symptoms that are indicators you should have your child evaluated by a healthcare provider. Anytime babies look like they're having respiratory distress, they need to be seen promptly. Signs of respiratory distress include the baby's belly going up and down rapidly as they breathe. They can also have retractions, which will involve the muscles in between the ribs, below the rib cage, and in the neck pulling inward as the baby breathes in. Some babies will have nasal flaring. This involves the baby's nostrils opening wider when breathing in. Other concerning symptoms include noisy breathing or making wheezing sounds. If a baby has a temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher in the first month of life, they need to be evaluated promptly. Children who are older should be seen if their fever is not improving with appropriate doses of fever-reducing medicine, or if fever continues for 5 days or longer. Other concerning symptoms include the baby's cough continuing to worsen even after doing treatment with nasal saline, suctioning, and humidification, or cough lasting longer than 2 weeks. As uncomfortable as it is when your child is sick, remember, this is a way that your child develops immunity towards infections, and the process actually works to strengthen their immune system. By doing the things that I mentioned in this video, you will be able to alleviate the runny nose, nasal congestion, and cough, and help your child get over them quicker. See you in the next video.